Well, PGD stands for pre-implantation genetic diagnosis. It's actually a sophisticated technology that we use as part of IVF. And what we actually do is on day 3, when we grow the embryos in the laboratory, is actually take one cell out of the embryo. And at that stage, the embryo's probably got 6 or 8 cells. From that one cell, we can get enough genetic material to be able to test in the laboratory and ascertain whether that embryo is genetically normal. So if we can select genetically normal embryos to put back into the uterus, then that's going to help us get our patients pregnant. Pre-implantation genetic diagnosis is used mainly in 2 key areas. The first of these where there's a couple where one of them may have a genetic disorder that they wish not to transfer onto their future children. So what we can do is test the embryos in the laboratory in a way of ascertaining the normal ones and not being able to transfer that genetic disorder on down the family tree. The second reason we use pre-implantation genetic diagnosis are for those couples that have unfortunately had multiple miscarriages. So it's a way of being able to better select embryos, genetically normal embryos, to go back into the uterus. So if we can select those ones out first, then we're definitely going to improve the chances of our patients conceiving. One of the biggest developments at IVF Australia in recent times has been the introduction of CGH. Now, CGH, or comparative genomic hybridisation, is where we actually test the embryo for all 24 chromosomes. What this actually entails is being able to test the embryo on day 3 while it's growing in the laboratory and have the results back before we need to do the transfer on day 5. So this technology enables the testing of the embryos plus being able to do a fresh transfer on our patients. Since the introduction of this technology in the last few years, we've really seen some fantastic results.